Whether you're a life coach, therapist, biohacker, invested in wellness, or in the healthcare profession, if you have an intention to work in psychedelic spaces, you're in the right place then. If you're called, get involved. But first, get informed. Let's talk the 4 N's: intake, intention, in-space integration, leading to deeper transformations. Psychedelic Coach Podcast, Tah Cole. Walk you through the process, it's all possible. Leave space for the follow-through. Most importantly, integration is not optional.
Some things need to be healed in community, and we offer you something unparalleled with the Condor Approach Live. We're going to talk about how to prepare for, navigate, and integrate your psychedelic experiences for yourself or those that you love. These live events are catalysts. They really allow you to uncover and unleash the potential that you already have within you. When you're surrounded by like-minded people who are walking the walk and are committed to the path, you may even find your next facilitator or coach, but this event is designed to foster genuine relationships, give you community that supports and uplifts you, wants to see you win. If you've been wanting to embody this understanding and take these skills to a new level, then a live dynamic environment is just the way. You can go to thecondorapproach.com. That is thecondorapproach.com, and we will see you in February.
All right, y'all. Welcome to the Psychedelic Coach Podcast. This is Tah, and I'm super excited today to have the CT Cannabis Nurse, Lisa Capitani, here with me today. We're going to talk about something that we haven't really talked much about on the Psychedelic Coach Podcast, but I'm going to talk about it with Lisa because Lisa has a very interesting angle, a very special angle on how she approaches cannabis. We have not really dove into cannabis as a psychedelic or with psychedelic properties or anything like that. We haven't found many people who work in spaces of integrating cannabis. People talk about cannabis for healing. People talk about cannabis for expansion. But I have seldom spoken with people who have designated integration protocols around cannabis. And I'm really excited. Welcome to the Psychedelic Coach Podcast. Lisa, how you doing today, family?
I'm great, Tah. Thank you so much for inviting me to join you on the show today.
Yeah, you got it, family. Thank you for being here. Thank you for bringing an exciting topic. There's been a lot around the legalization, the decriminalization of all state-altering substances, particularly cannabis. Cannabis has been at the foreground of legalization and opening up for people to be able to move into different expanded spaces. And it's been a wonderful space to open things up for psychedelics. So cannabis has paved the way, and I have a lot of reverence for cannabis. Cannabis is not my space of expertise, so I'm honored to have someone here who is an expert in that zone. And so I'd love to hear a little bit about you. Tell people about you, family. What's your journey with cannabis? What's your journey with utilizing cannabis as psychedelics and so on? Just go for it. Tell me.
Sure. So like you, I'm also a registered nurse. I knew I wanted to be a nurse when I was in high school. I set myself right on that path. I wanted to be an ER nurse more than I wanted to be anything else in the world. And I went away to a 4-year school right out of high school and got my bachelor's in nursing, which was one of the hardest things I'd ever done. Nursing education was then and still is one of the most difficult bachelor's degrees to obtain. And throughout my journey in college, I discovered cannabis as a recreational drug, which looking back now, I really did pick it up solely to help me deal with the stress of nursing school. So I was applying it medically from the beginning, but the current state of healthcare education in this country really closes our eyes. It boxes us into this belief that if a medicine or a therapy doesn't have randomized, controlled, double-blind clinical trials, that therapy or that medicine just isn't valid and isn't looked at by the healthcare industry as something that should or could be utilized in people's wellness and healing. I worked through several years in the ER, very busy urban ER, lots of trauma, taking care of lots of patients going through really difficult experiences, and also experiencing some difficult things in my life myself. In 2009, we had a long forgotten now epidemic of swine flu where I live, and that really burnt me out. And I made a really difficult choice back then to step away from the ER and change specialties. And within a month of doing that, I myself became a trauma patient and ended up in the ICU, having multiple surgeries for a number of fractures and a pretty significant head injury with traumatic brain injury. And I spent the next decade really rehabilitating and recovering from those injuries, being told that a lot of the lasting effects were permanent. There was nothing I could do about them. Throughout that time, I continued to use cannabis, but again, I didn't have space based on my conditioning and the way I was raised to see cannabis as medicine. Several other very difficult life circumstances came about during that time, and I really struggled with not being able to find myself in a nursing position where I felt fulfilled. I felt like I was doing what I could do, never what I really wanted to do, and just went down this path of losing myself, losing touch with my identity, forgetting how to take care of myself and love myself, which is not something that, again, we really learn how to do as people and as especially healthcare workers and nurses. We learn how to take care of everybody but ourselves. Mm-hmm. And then the pandemic hit in 2020, and that was a hell of a time to be a nurse. I was working in the Metro New York area, was floated from my unit. I had been working in GI or endoscopy, which is a lot of outpatient elective procedures that were all canceled. And they didn't need us there, so they floated me to the emergency room where I hadn't worked in a decade. And I really began to suffer significantly from PTSD symptoms. A lot of things that were triggered from my own accident, from my prior nursing experience. And when everybody started to go back to normal in the middle end of 2020, I just didn't. I really began to suffer a lot of health collapses. I couldn't keep working. I had some misdiagnosis and some wrong surgeries that didn't solve my problems, and really started to give up on the healthcare system. Coincidentally, during that time, my mom came across an article about cannabis nurses out in Oregon, and she forwarded it to me and asked if I had known that was a thing, and I had not. And that really opened my eyes to this idea that if there's nurses getting involved in cannabis, then there must be something to it, right? There must be medicine there. So I decided to get my medical cannabis card, was sent to a pharmacy, a dispensary where they have a pharmacist. That's our model here in Connecticut. And the pharmacist walked me through what products I should try and start with. And I was really curious. I've been using cannabis my entire adult life, and I'm a healthcare professional. What does this person know that I don't know? Which turns out all those years of hearing that there's not enough research really, we're just pulling the wool over our eyes, because there's tens of thousands of articles about cannabis as medicine. And I started to try and read every single one of them, just get educated. And I started on a journey of treating myself with cannabis, which almost immediately, when used intentionally in the way I did it, which is not how I had been doing it before, started to reduce my pain significantly, started to reduce my anxiety and other symptoms around the PTSD significantly. And in that relief, I describe this as it really opened up space for me. It gave me space to consider that there might be another way to approach my problems. There might be another way to live. I could start to identify some patterns in my own behavior, my own sort of limiting beliefs that really started me on this path to finding alternative methods of being that work for me to reconnect with myself, rediscover myself, change, grow, learn. And I really credit cannabis first with opening my mind to that. And second, one of the very first sort of interventions I came across when I started researching ideas other than allopathic medicine was your Condor Approach 7-day journaling challenge. and I was broke and didn't have a job and it was free. So I gave it a try. And it did a lot of things for me. First of all, it made me feel really good about myself that I was able to complete it. Just the act of getting it done was a boost to my confidence. But it opened my eyes with the body mapping to just this understanding that there is a lot of knowledge in the world that may not have scientific backing and may not be peer reviewed, but it's knowledge that's worked for thousands of years. And it's going through that process of the body mapping and identifying sort of potential underlying themes or causes to some of my physical discomfort just really was a paradigm shift for me. It gave me a chance to look at questions that I had been too afraid or too blind to look at. And of course, with learning about cannabis and naturally move into learning about psychedelics, which have also been an integral part of my healing journey. And as I started to learn more about psychedelics and how and why psychedelics work the way they do, I recognized so much of my own experience with cannabis in that same process. It wasn't as rapid as one session, one megadose, and your whole life changes forever, as we sometimes think about with psychedelics, but it was a slow and gradual process, which I needed after over a decade of really neglecting my own self-care and my own needs. It gave me a chance to work through a lot in a short period of time comparatively.
Wow. Thank you for sharing all of this. And thank you for your courage in stepping up and out as a nurse to move into a space that is completely unconventional. Thank you for that. And thank you for your story. Thank you for everything that you've experienced to get yourself to this point. Thank you for leaning into the Condor approach, taking what you've learned from that, putting your own twist on it, and then putting this out for people to utilize in the cannabis space. It's genius. It's ingenious. It's taking the things that you've learned, concocting and making something that works for you and for the people that you can serve. I think it's absolutely beautiful. What have been the biggest challenges for you as a nurse when you have RN after your name and you start talking about cannabis? What are the biggest resistance points you've found from people?
Fortunately, I haven't found too much. My cannabis use and cannabis in general wasn't something I ever talked about prior to leaving the hospital. My direct experience in talking to healthcare workers who are on the ground at the bedside daily has been less prevalent, but I have received a lot of curiosity and a lot of interest from healthcare providers. For me, it was at first a matter of really realizing that I had internalized a lot of that shame and bias that I anticipated should anyone find out about my cannabis use when I was working in the hospital. And that was another part of the growth, was to let go of that and accept that I needed to use this medicine to help myself, and that was okay. And I find that when we are able to humanize someone's experience, it's a lot easier for people to not judge it based on that sort of misinformation and bias that comes along with cannabis. I've actually been really fortunate first of all, we have a network called the Cannabis Nurses Network, which has just been a huge source of education and inspiration and camaraderie, community, so much support, so many mentors that I've found through that program, that network, that have helped. They've been working very hard for a very long time, along with the American Cannabis Nurses Association, to really normalize cannabis in healthcare. Back in September, the American Nurses Association actually approved and put out a statement that they will now consider cannabis nursing a approved specialty of nursing, which is really incredible. So within the next few years, we should have education standards and a board certification exam for cannabis nurses, which is decades of work in the making. And in light of that news, I've been asked to speak to, along with a panel of other nurses, we've spoken now to nursing organizations in 2 different states. We're on a mission to start to really bring this message into the healthcare system, make change, share our stories, share our clients' stories, and let people see how excluding cannabis from healthcare down to the level of patients feeling unsafe, even talking to their providers about any cannabis use they may have, it's not serving anyone. It's not serving anyone. People need to be able to share what their health and wellness goals are, how they take care of themselves, what their concerns are about using medicines that may or may not be federally legal. They're being used anyway, and they're going to be used whether it's legal or not. And it's time that the healthcare system stop judging people based on 100-year-old misinformation.
Amen. Oh my gosh. Amen. We have so many defunct things that we're still holding on to. And when you look at particularly the healthcare industry, the wellness industry in the United States of America, when we develop a technology, there's a lot of money that these companies put into the technology or into the medicine. And so it has to run its course of making money.
Yes.
And if it doesn't run its course of making money, it becomes an issue for the industry. There have been periods of time in my career where I've watched doctors be forced into prescribing certain things. They become formulary. And formulary is when we have a particular substance or drug that we use at the hospital, and this has to be used for protocols for an extended period of time. And they're actually running studies on it and all of this stuff. But it's a money machine. And so if you have something like cannabis that people can use on their own, that people can utilize, that people can grow on their own, it puts the kibosh on big pharma's money situation. And that becomes an issue. And it's not just big pharma. We have med tech, we have surgical implements and things that are defunct, that have been defunct for the past 20, 30 years, but we're still using them because they have to stay there as the next stuff is gradually ushered in. And we have new technologies, we have new ways of utilizing cannabis and psychedelics and stuff that are way beyond the last 5 years, right? And we have to wait until the medical industry says it's okay for us to utilize these things. So when you say that these things that we've been doing for 100 years, this is not, you're not just like exaggerating. This is dead serious stuff. And cannabis has been around for eons. And for us to be able to utilize this now in these ways is absolutely, for me, it's heartwarming, it's groundbreaking, it's magnificent. And I see so much hope for the industry in the world. And so since we're on the Psychedelic Coach podcast and you speak about utilizing cannabis as a psychedelic, what does that mean?
Like I said before, looking back on my experience and how my relationship with cannabis changed, it really brought me into more of a psychedelic mindset, right? Meaning being more in the now, paying more attention to what's happening inside me, utilizing techniques of mindfulness and breath work and movement and other ways of getting in touch with myself to further that self-exploration, that journey. And all of that for me started with intentional cannabis use, and doing the 7-day Condor Approach journaling challenge really was what inspired me to, as I started trying to explain how I would work someone else through this kind of journey. It all really started with this idea of intentional cannabis use, taking advantage of magic that cannabis has, which isn't really magic. It's just some process of consciousness that we probably don't understand and can't explain with science yet.
Sounds like magic to me.
Sounds like magic, right? This magic that cannabis has to expand consciousness. So it was my process and the Condor Approach journal that inspired me to create Weed Week, which was a 7-day journaling challenge that I created and self-published at the beginning of last year, which brings in this idea of, let's take our regular cannabis use, whatever that looks like to the individual, and start to, at least one time per day that we're consuming, assign some kind of intention to what we're doing, why we're using, what we're going to do while we're using, and take the time to really process and reflect and integrate what we're learning through this process of adding more intention to our cannabis use. And as I, in my own journey, again, progressed through now having a very intentional cannabis practice, going deeper than that, I really, again, seeing these kind of parallels between the psychedelic experience, I decided to do some research and start to apply the same ideas around set and setting to the use of cannabis. And there are several resources out there. Daniel McQueen out in Colorado has a really fantastic book on psychedelic cannabis and the process he goes through. And Ryan Sprague, who does the conscious cannabis, they're very inspiring in showing me that using cannabis with these ideas of set and setting, with this ritualistic intent, can really parallel that experience. And as I've worked with it with clients and with friends and family, you see a very similar set of circumstances happen during a psychedelic cannabis experience as you would with any other psychedelic experience. It's all a matter of getting in the right mindset, putting yourself in the right setting to be open to that magic, to that possibility that this plant can show you things that you're ready to see and understand. And I've seen people have very cathartic releases of just built up energy, whether it's just shaking or crying or laughing hysterically, getting out that trapped energy in similar ways as I've seen happen with psilocybin and other psychedelics. The process is very similar to what you would probably anticipate in any other psychedelic experience, but with cannabis, we have this opportunity to start slowly, to change our relationship with cannabis first, to introduce different tools and techniques that allow us to expand our ability to be mindful, to be aware, to start to understand some of the dysfunction in our lives and know where we can make changes and find easy ways to make those changes so that they stick, so that we can heal and grow and move through life with a lot less of the drama.
Thank you for that. I grew up in Flatbush, Brooklyn, and the people that I stayed away from weed when I was a kid, right? And because I didn't want to get in trouble with my mom, right? And staying
Fair
away
enough.
from it. I didn't try weed until I was 36. And the first time I tried alcohol, I was 25. And so I had a lot of fright around substances, period. And I learned to stigmatize people who smoked weed. And I learned even further in the hospital to stigmatize people who smoked weed or people who did edibles. And they looked this way, they had this type of tattoo, their hair was this way, and they spoke this way. And as I've moved into the space of really starting to understand things, when I started to explore psychedelics 10 plus years ago, I started to see that it's not the substance that is changing people. It's the people that are changing. They're using the substance to have access to themselves. And when I met a guy named Loren, and Loren is an amazing guy. He lives in New York. And he's the first person that introduced me to the idea of intentional cannabis use. And I was like, what are you talking about? He's like, well, just like you go for your psychedelic experiences, I support people in having cannabis experiences, but I had to change my relationship with it. And it sounds pretty much like what's happened with you is you had to establish a relationship with the substance. And when you establish a relationship with the substance, you actually integrate with it. And then you get your set and your setting to agree with it, and everything falls together. And this is something that in all of I've been to cannabis conventions, I've been to all of these different things, and I've very seldom heard of anybody doing it as intentional as Lauren and you. And so this is one of the reasons why I wanted to bring you on here so that you could talk about this. And I know that you do group coaching with conscious cannabis use. Can you say more about that and what that looks like, how that works?
Sure, yeah. I have been running week-long live group coaching events using Weed Week as the foundation. And that has been really fun, and people have had really good experience with it. But I want to expand on it and bring it to the next level. So I've put together what will be an 8-week adventure. It's an on-ramp to deeper self-discovery and wellness using psychedelics, starting with cannabis. So it's based on, again, my own journey with intentional cannabis and how it has this potential to expand consciousness, It's going to be virtual, so anybody can join. This 8-week program will be really great for anybody who already has a relationship with cannabis and maybe is looking to change or deepen that relationship for whatever reason, to lower tolerance, to try new methods of administration, to target different health or wellness goals, maybe even just to save money. There are lots of potential changes that will happen during this 8-week course. This 8-week program. It's really going to be a transformative experience. And it goes beyond cannabis. Like I said, it's a stepping stone into exploring psychedelics. So if someone has some trepidation or some fear around using psychedelics, or especially people with a history of trauma, we talked about this before, you and I, Tah, but the use of psychedelics in someone with trauma can be a scary situation. Using a psychedelic like psilocybin or LSD, you lose control. And for a lot of people with a history of trauma, that sense of not being in control can be very triggering, can be very scary. Cannabis, even when you are super, super high during a psychedelic cannabis experience, especially with a facilitator, someone who's there to support you, and a lot of preparation, when you hit those moments where things are too intense, which can be really scary in a psychedelic experience, with cannabis, all it takes is to sit up and open your eyes and take a deep breath and say, whew, I'm really high. And take a few minutes, recenter, ground yourself, work with the facilitator to do some breath work or whatever else you need to really calm down the nervous system. And then you can lay down and go right back into it, which isn't really something you can do as easily with some of the other psychedelics. We'll go through several weeks. The first 3-4 weeks are going to be getting an understanding of why we want to change our relationship to cannabis, being introduced to a lot of different resources and tools, different awareness practices, movement practices, breath work, body mapping. There'll be lots of opportunities to pick and choose what will work for you, or to try something. Doesn't work, it's not mandatory, it's not homework, right? This is to help each individual sort of step into a healthier, more self-aware process of self-care through the use of intentional cannabis, along with all these other supplemental activities and practices that can create a foundation of health and wellness for us. And so there'll be weeks of preparation and getting to know each other and really diving into the community support element of being in a group of like-minded people, working on releasing any of that shame, that stigma that we've internalized toward ourselves is a lot easier to do when you're in a group of people who feel the same way and have had similar experiences in their relationship with this plant. And then there'll be either virtually, or if you happen to be in my area in Connecticut, we can do in person the psychedelic cannabis experience. I'm going to teach people how to set themselves up, what products they'll need. The program itself does not come with any products. I don't provide any products, but I will teach people exactly what they need to put together just the right blend of strains to experience the best possible psychedelic cannabis experience. And then we'll spend 2 weeks really going deep into integration, working in healing circles together to process what we've learned, and coaching around how to apply that learning going forward into healthier ways of being.
That sounds absolutely epic, fam. This sounds well thought out. It sounds well planned. It sounds like you've taken yourself on this journey and now you're applying it to other people. Thank you for this. I've had a lot of conversations with people around psychedelics, and people are like, you know what? Psychedelics frighten me. I'm a cannabis person, but I wish that cannabis could take me to the places that people are telling me psychedelics are going. And this sounds like you have an angle to support people in getting into those spaces.
It sure can, yeah.
Yeah, and so this is do you teach other people how to coach in this space?
I haven't yet.
Okay. Just asking because it sounds like an interesting space to support people in growing into. And so it's an 8-week program that you have coming up, and it includes Weed Week. So tell us about Weed Week, because we skimmed over the Weed Week thing. Tell me all about Weed Week. I know you came up with this, and this was maybe inspired some by your experiences with the Condor Approach Journal. Tell me about Weed Week.
Yeah, it absolutely was inspired by the Condor approach and by Cole constantly saying, you can't change what you don't track. And as a nurse, as someone who is more science minded than art minded most of the time, I like data. What can I say? I like to see the data, and being able to track our own data, be able to go back and look for patterns in that data, for me was pivotal in helping me identify what areas of my life I needed to pay more attention to and really make some changes in what order of priorities. Weed Week is a physical book, a copy right here. It's a 7-day challenge. There's prompts for each morning and each evening, along with a set of scores based on your different areas of your life that may be causing stress, to start to collect that data, right? And then throughout each day, there is a option to do either 1 or 2 sessions with yourself, where you sit down, you set your intention, you record what you're consuming and how much, then you do your consumption, you go through whatever process you were planning to do for that intention, whether some ideas, things that I would do is consume and then meditate, or consume and do yoga, consume and take a walk in the woods, trying to pay attention to all the sights and sounds around me, consume and have an important conversation I've been avoiding. Whatever the intention was, you make that happen and then you reflect upon it afterwards. And it's all really structured around this 4-part healing process that I've used to really explain my own journey. And that starts with awareness, right? Again, you can't change what you don't track. You can't change if you don't realize that there's something to change. The process of awareness is, it's becoming someone who lives in the moment, someone who is paying attention to the things that are happening in and around them, which for someone like me who had a history of trauma and a lot of physical injuries and physical pain, I had a serious disconnect between the things that were happening in my body and the things that were happening in my head. And that becoming aware of that, and then becoming aware of all the ways that was showing up for me, helped me to start to understand. And understanding is the next part of the process. And I don't think we need to do like a psychotherapy level of understanding to be able to make change. The understanding can be as simple as, well, now I'm aware of this pattern in my own behavior, and I understand that it has negative consequences, and that is what prompts us to change. We can always go back later and dig deep into the whys and the hows of where this dysfunction came from. But we don't need to know all that in order to change. We just need to recognize that it's causing consequences. We don't want to do that anymore. We're ready to change. And I feel like the change process sounds big and scary, but can be approached with coaching, with small goals, small steps, forward momentum. It starts very small. For me, it started with, I'm going to sit in the quiet for 5 minutes a day. I'm going to take a walk twice a week. And starting on that process, those things became easy to do. It was easier to add other things. And the momentum grows. It's like a snowball rolling down the hill as the one little change turns into 2 little changes. And before you know it, you have adopted a healthier lifestyle with changes that were easy to make for you. I don't think that this process has to be hard. I think it can be challenging, but we can break any big change, any transformation down into really tiny parts. And as long as we keep moving in the direction of change, then we're going to heal. And that's the last step, is that we heal. And I included healing, even though it's a healing process, because if I hadn't, I would have skipped right over it. I would have gone right back to the dysfunctional thinking and behavior that I had before I made the changes, because I had to own and recognize that I have discovered how to heal myself, that I had this in me all along, that you have it in you, that everyone who walks on this planet already has the ability to heal themselves. We used to associate the healthcare industry with healing. That's not what it's there for. We talked a little bit about it already, but the healthcare system is broken, and it requires us to be broken to benefit from it. There's a time and a place to see a surgeon. There's a time and a place to take medicine, antibiotics. It's overused. Things are overprescribed. If we're not the ones empowered to take control of our own health and wellness, we can't rely on a broken system to do it for us. And I can't think of any better way to take control of your health and wellness than to cultivate your own experience with a medicine as versatile as cannabis.
Mic drop, family. Let's go. Let's go. That's what I'm talking about, Lisa. Thank you so much. That this last 5 minutes my body is covered in goosebumps from the conviction with which you're speaking about this. Thank you for this. This is such a gift to the listeners here. We have a bunch of people that listen to the Psychedelic Coach podcast, and I like directing people into places that they can synchronize with. And I like to direct people to practitioners who fit them. And so who do you absolutely love to work with? Like the people that are going to come to you and get the most amazing results because they're all in. Who are those people?
I like to work with people who are comfortable using cannabis, who feel that they've got the impression that there's more that they could do with it. They have an inkling that there's more to do with cannabis, and they're willing and ready to explore that. People who have been challenged by trauma, who are dealing with identity crises, who have chronic health problems or chronic pain are the kind of people that I really, I've been there. I've experienced it and I've moved through it. And I want to help people be able to find that light inside themselves, that wisdom that knows how to heal with the help of cannabis, together with someone like me who can share my own experience, share some of the tools that worked for me and some of the tools that didn't work for me but might work for you. It's going to be this new program, and it's going to be a very tight community. It's going to be very supportive. Everyone will be allowed to be vulnerable without judgment. Everyone will be accountable. There'll be just a strong sense of community that I think a lot of us are missing these days. That's something that I really am trying to work into my coaching and my practice.
Epic. Thank you so very much. And thank you for trusting yourself with this in bringing this to support other human beings. Thank you for trusting the Condor approach, for leaning into that. And it's wonderful to watch somebody who's been watching me in Cole for a while, taking the things that you've learned from us on social media, right? Like you've learned stuff about us on social. You haven't even been to the Condor approach yet. I know you're coming though, right? You haven't even been to the Condor approach yet, but you've taken the concepts and you've applied them to your own life, and then you've applied them to the work that you're doing. That is a gift. We love the Condor approach and we love the things that we do. We are here because we want to support human beings. And watching what you've done with what you've learned from watching us and your career and adding in your experiences and adding in your knowledge of cannabis to bring this gift to the world is such a gift for me to witness. Thank you for you and for who you are and for what you bring to the world. And tell the people where they can find you, how to reach you. And we're going to put that in the liner notes, but I want you to say it out loud.
Sure. So my website is lisacapitani.com. There's a page there under group coaching for the program, which is going to be called Unlock. Hold on, stop. You think I should know that, right? All right. So visit my website at lisacapitani.com. There's a page, lisacapitani.com/unlock potential. That's going to be the page for the new group coaching program. And in order to join the program, you will have to go through a screening process to be accepted for the program. And that will start with an initial questionnaire. You can fill that out if you're interested. It's not an obligation, and nor does it mean automatically that you're accepted into the program. You can fill that out at tinyurl.com/PCE screening, Psychedelic Cannabis Experience Screening. Visit, again, the website. You can find that on the website. And anyone who hears about this program through this podcast today can mention the Condor Approach or Psychedelic Coach Podcast in the referral section on that form, and I will give you 15% off of the package. We'll also have a link for you to book a call. You can book a call with me on my website, 30-minute discovery call, to talk about anything, whether you want to join this program or you're interested in one-on-one coaching or Weed Week. I'm happy to sit and discuss all the different options I have available with you.
Epic. That's what I'm talking about. Get on the phone with Lisa, y'all. Get on the phone with her. She's a human being. She's approachable. She will talk to you and she will offer you some guidance in that call. And if y'all are a fit, then you can work together. It's an absolute gift for you to know Lisa and to talk to her about her expertise. It'll knock your socks off. Thank you, Lisa. I appreciate you. Lisa Capitani, y'all. It's been wonderful. CT Cannabis Nurse, changing the world. Thank you for listening to the Psychedelic Coach Podcast. I love you. Don't forget, the Condor Approach is coming up February 22nd to the 24th, 2024. Join us at condorapproach.com. I love you. Thank you so much. Be easy, be free, and don't forget,
Integration is not optional.